Well, a Silicon Valley startup has come up with a new genetic test for breast and ovarian cancer that could help save the lives of millions of women. It's an inexpensive mail-away kit which tests your saliva for 19 genes, including the BRCA1 and 2 genes. This type of genetic testing, is it the future of diagnostic medicine? Well, joining us now to talk more about this, Dr. Deborah Lindner. She's an OBGYN at Northwestern University and the Chief Medical Officer for Bright Pink, a nonprofit organization focused on prevention and early detection of breast and ovarian cancer in young women. She herself has actually tested positive for the breast cancer gene and actually underwent a double mastectomy as a preventative measure, and she's joining us now. Welcome, Doctor. Great to have you here.
Thank you so much, Uma.
A lot of people are saying that this really is breakthrough technology in that if women are open to using this kit, they really could be working to save their lives because it is a safe way to go about detection, and people can avoid using those machines that are used for mammograms.
You know, Uma, it's an incredibly powerful tool. When women are high risk because they carry a familial mutation for this gene, their risk of breast cancer is up to 87%, and the risk of ovarian cancer is up to 54%. And so knowing this information can really give women the ability to make decisions that can lower their risk of both breast and ovarian cancer.
So tell us more about this kit that people are using now as another way to test for breast cancer.
Sure. You know, historically, we've always done genetic testing through a physician's office or a genetic counseling office, and it typically has required either a blood draw or saliva test that's then sent in by the physician, and then the patient comes back to receive the results several weeks later. The interesting thing about this test is that it's a saliva kit that a patient can do in the comfort of their own home, and so patients really are going to have more access to this, but I think even more than the technicalities of how to do the test, the really incredible thing about this is that the test is $249. Testing for this panel of genes typically costs $3,000 to $4,000 depending on the lab that's used. And so it's just incredible to be able to offer patients access to knowledge about their genetic makeup at such a low cost.
It's such a low cost indeed, but how reliable are these tests in terms of the accuracy? Because if, for example, someone comes back with a positive result, that person may actually panic and be very concerned and automatically decide that, oh my gosh, I have breast cancer, and leap to lots of conclusions. Don't you need to have the support of doctors and also be dealing with a doctor who is actually overseeing your care?
Absolutely. It's incredibly important to do that, and I think that this company has been doing a very responsible job of ensuring that patients who do this test have an order from a physician and then either have genetic counseling or they're offered genetic counseling free of charge from the company. That's an incredibly important piece because certainly there are positive and negative results for this test, but about 3 to 4% of women will come back with a variant of undetermined significance, which means we don't know how high their risk is. We don't know if they truly carry the gene. And so for those women, there's a real need to have genetic counseling available to understand what they should do.
Okay. All right. This sounds like a great way an alternative for women to move forward with this type of testing. Doctor, I'm out of time, but I appreciate you joining us today. Thank you so much.
Thank you so much.